Rams wide receiver Cooper Kupp injured his right lower leg on this play, and in this video we're going to walk through the anatomy of what I think might have happened with this injury. Welcome back everybody, I'm Dr. Brian Sutterer, and if you're new here and enjoy learning about the medical side of the sports world, then please be sure and subscribe because I try to get videos out as quick as possible after all big injuries happen. At the time of recording this, Kupp is officially listed as doubtful, and it's being reported as a right ankle injury. So let's start off by looking through the footage here with what I think might have happened with the mechanisms. Honestly, when I first saw this, of course, just the initial replay, you think about ACL, right? Anytime we see an athlete who suffers a contact injury mechanism with a trauma or a force coming in from this outer portion or lateral side of the knee, whenever we see that knee buckle inward like we saw here with Kupp at the end of this play, I think everybody understandably thinks about the ACL. So it's great to hear the report of an ankle injury and not the knee being the primary concern. I think part of the reason why his knee might have been spared here is because of how much his knee seems to be hit a little bit more from the back of the calf right here as opposed to directly from the side, and how much you see his knee go into flexion right away. So his knee almost bends kind of straight forward rather than directly inward. And so had the Cardinals player kind of come in more on the side of him, I think this probably could have been a bad knee injury. But because he lands more on the back of the knee, pushes the knee into more direct knee flexion than true kind of inward valgus load, I think that's probably what spared his knee. Next, I want you to pay attention to where Kupp is grabbing on his right leg. You'll see he's kind of grabbing a little bit higher up, kind of in that mid portion of his lower leg. This actually makes a lot of sense based on what I think this injury mechanism was, which is likely some sort of a high ankle sprain type of pattern. The tissue that's involved extends higher up into this mid portion of the leg, and so it makes sense why a lot of players will experience pain kind of higher up in this area. Another injury I worry about with this pattern up at the knee, though, is a patellar dislocation or dislocation of the kneecap. Because sometimes that knee might fall inward a little bit, the kneecap can have a tendency to want to sort of pop out to the side. The MCL is also something that comes to mind when we see these sort of severe amounts of kind of knee hyperflexion where someone's kind of twisting off to the side, but the report, of course, is the ankle. My suspicion when we hear about an ankle injury with this type of mechanism is a high ankle sprain or an ankle syndesmosis injury. Of course, we can always have fractures and things like that, but when we're talking about just at least ankle sprains, with this mechanism, a high ankle sprain is going to be much more common than a typical inversion or a lateral ankle sprain. And that's just because of the direction of the forces here. If you think about as Kupp is coming down to land and you look at where his right foot is located, his right foot is going to land in the turf and be firmly planted. Then as the Cardinals defender comes in here, the foot's planted, he makes contact, that foot is going to be anchored. But then we'll see that Kupp's body starts to rotate a little bit. He kind of twists here. And because his foot is still anchored, his foot's going to be basically pointed off in this direction externally while his body is sort of being twisted and knocked in from the side. So what that's going to do is have a tendency for the ankle to evert or externally rotate more than invert or roll like you see with a inversion. With our biodigital anatomy tool here, we're looking at a right ankle. And this ligament that I've got shown here in pink is the high ankle sprain ligament. It's the AITFL. It stands for anterior because it's in the front, inferior because it's the lower portion of the leg, tibiofibular ligament. The standard inversion low ankle sprain ligaments are going to be here on the outside running from the fibula bone down to the rest of the ankle. And then on the inside of the ankle is going to be the deltoid ligament complex. When we talk about a high ankle sprain, of course, with eversion or external rotation, the foot is going out in this direction. So with Kupp, if you think about his foot planting in the ground here as he lands, his foot is going to be anchored, but then there's going to be the defender come in that's going to push the top portion of his knee in that way. So then when the foot is locked in place, it's going to have that tendency to go out into eversion rather than roll inward. When that motion happens for a high ankle sprain, basically the talus, which is the bone that kind of sits in the mortise of the ankle joint, wants to basically push apart the tibia and the fibula. So it pushes these two bones apart, which stresses that high ankle ligament. The reason we saw Kupp grab higher up is because there's actually the structure called the syndesmosis or the syndesmotic band that runs between the tibia and the fibula pretty much all the way up the lower leg. It's sort of continuous with this AITFL. And so injury mechanisms that result in high ankle sprains can sometimes transfer energy up through that syndesmosis and sometimes even all the way up to the knee where we end up with a fracture of the fibular head. So it's not uncommon at all for people with high ankle sprains to be kind of grabbing in this area higher up because of how that energy gets transferred up through that syndesmosis. This is why we give it the name a high ankle sprain. Interestingly, there's data out there to help with prognosis for high ankle sprains that looks at how tender somebody is when you push on their leg, working your way up in this direction. Basically, the more tenderness you have higher up, the more significant of an injury it is and the longer your recovery is going to be. And also keep in mind, there's always fractures that can occur here. This ligament injury can become so severe that the joint is unstable and you need surgery. You can have fractures on sort of this inner portion of the medial malleolus. You can have fibula fractures down below or fibula fractures up high. So again, there's a mechanism that can oftentimes result in a high ankle sprain, but we can see things like fractures and other severe injuries, dislocations, just based on how that energy gets specifically transferred. Expect Kupp to get x-rays right away at the stadium to look for any signs of dislocation or instability of the ankle joint, to look for fractures of both the ankle and then remember higher up at that fibular head up by the knee, and then likely an MRI tomorrow to really look for the full extent of the injury. Remember, sometimes you can have a high ankle sprain and something like an MCL tear, and injuries can sort of cloud one another. So we always have to do our evaluation of the joint below and above the injury to make sure we're not missing any additional damage. That's it for the video, everybody. Let me know, as always, any questions or comments down below. Until next time, we'll see you later. Bye.